Welcome to Longevity Now, Longevity Now FL. I'm Luigi Fontana, Scientific Director of the Charles Perkins Center RPA Clinic and Longevity Program of the University of Sydney. Today, I would like to discuss with you these very interesting results from published in JAMA Neurology on these increased trends in stroke incidence in men and women younger than 55 years. Yes, younger than 55 years. Before we thought, that stroke was only a disease of the elderly. Again, these and other data suggest that is not anymore the case. So in this paper, let's look at the data. Basically, between 2002 and 2018, among all these people who had the stroke in this cohort study, 67%, there was a 67% increase in stroke incidence in men and women younger than 55 years, and only a 15%, and there was a 15% reduction in those older than 55 years. Not only the incidence of stroke, but also the incidence of the transient ischemic attack, that is basically a powerful risk factor for having a stroke, was increased by 87% in those younger than 55 years. So in these young people with the stroke or the pre-stroke, there was a significant association with diabetes, with a relative risk of 3.5 for diabetes, hypertension 2.5, current smoking 2.4, obesity 1.4. However, even after correcting for this risk factor, there was still an increased risk of developing stroke. And what is interesting is that the greatest increase in stroke was in professional and managers, with a relative risk of 2.5 compared to partially or unskilled workers who had just a 17% increased risk. Again, we're talking about people younger than 55, suggesting that the work-related stress, the high mental stress of managers and other high-level occupations, coupled with low physical activity, because these people they are so busy, they have very little time, to exercise. They work long hours, they travel a lot, jet lag, and of course they have most of them, they have unhealthy diets because they are so very busy that they grab sandwich or hamburger or whatever they have, some of these convenient quick fast food. That's why it's called fast food, foods that are ultra processed, high in salt, in trans fatty acids and refined carbs, and many unhealthy ingredients that may explain, at least in part, these high increase in stroke in men and women younger than 55 years. Okay. So I would like to remind everybody that stroke is a major disease with major consequences. So imagine that you are 50 years old and you have a major stroke and you end up with a paralysis of part of your left or your right body, or all of it, depending how big is the stroke, where basically the emboli is located. Or you may have, if the stroke it's on the left part of the brain, affecting these Broca or Wernicke areas, you may end up, with speech problems. You are not able to speak anymore. And some people, they are not even able to comprehend what other people tells them. Or you can have vision problems, or psychological behavioral problems, and memory loss. So if you are 50, 55 years old, and you are working to support yourself, your family, and you have a major stroke affecting these different functions, as you can imagine, the consequences are huge and devastating. Therefore, I suggest that you find a good doctor and you assess with your doctor what is your health, metabolic health, what is the status of your risk factors, so your cholesterol, your blood pressure, your glucose, glycated hemoglobin, if you're smoking, your physical activity, your diet, your sleep, your gut microbiome, your inflammation status, and many other risk factors that I've explained in my videos on YouTube and on my books with a comprehensive approach in preventing more than treating chronic diseases, because as you know, and that's one of my points of my research and of my communication, is that 90% of healthcare expenditure in Western countries, for example, in US, CDC data demonstrate that 90% of healthcare costs are devoted to treat disease after they have occurred. And very, very little is used of this huge amount of money, because the last year the budget of US budget for healthcare was $1.1 trillion, 90% to treat disease after they have occurred. And as you can imagine, once you are 55 or 50 or 45 years old and you had a major stroke, there is not much you can do, because if your Wernicke or Broca area or other part of your brain are dead, because there is no more blood supply and they are dead, they are functionally dead, there is nothing you can do. There is nothing we can do, to bring them back to life. And therefore, you have to live with the medical, social, and financial consequences of what these disease has caused to your health. And so again, I suggest to everybody to reconsider how important is health, how important is prevention, and what you should do to minimize the risk. Zero risk doesn't exist in biology, in human biology, and therefore what we should do is just to minimize the risk. And we know that many of these diseases, like cardiovascular disease and diabetes, stroke, and many other chronic diseases, liver disease, kidney disease, and many of the most common type of cancers, are deeply influenced by our lifestyle. And the sooner we start to take care of these cardiometabolic, metabolic, hormonal, inflammatory, immune, and psychological, emotional factors, the lower the risk of developing diseases, in particular these devastating disease that, as these data suggest, may occur even in people that are still working. Not, like in the past, we thought, I get a stroke after, I'm 70, 80, when I'm already old at the end of my life. And so, okay. But if you are 50 years old with young children and the family, you have to support yourself, your family, and you have a major event like this one, life can become very hard. So I hope this video is a signal, is like a prompt for you to reconsider your health and what you want to achieve in life and how you can achieve it, and while minimizing the risk of developing major events like stroke, myocardial infarction, dementia, and many other chronic diseases. I hope this video has been helpful, and if you like this video, just share it with your family and friends. And if you like, you can follow me on my YouTube channel with other information on how you can optimize your health and reduce your risk of developing some of the most common chronic disease of our days. Thank you for listening, as always.